you know, the vaccine supply is still a bit limited, but more opening up. Why not just wait a little bit longer to do some of these reopenings and, I guess, not push the limits?
Well,
we're so close to the end.
I don't think we're pushing the limits. You know, I've talked about incremental flexibility. I think that we would be pushing the limits if we went from 0 to 60 in 1 second. We're not doing that, and we're doing exactly what I had asked to be done, which is this incremental flexibility, and I think that we're going to get there. And then also we got to measure. We got to keep on measuring what response we get from the people of the state of Rhode Island in terms of the safety protocols that we're asking them to follow. And as long as we're continuing moving in the direction that Dr. Alexander Scott outlined today, you can expect that we're going to do more flexibility.
Doctor, a couple of questions. One on serology. You mentioned that you've mailed 10,000 letters. You've extended the deadline. Is there an opportunity for people to volunteer for this? And then secondly, a situation in Warwick where homebound obviously are waiting to be vaccinated. I know you've outlined a plan to do this, but why can't EMTs that are prepared and know how to administer the vaccine, why can't they just go out and do this?
So both great questions. With the serology testing for this approach, we have it designed specifically as a randomly assigned approach. So instead of people who weren't already reached volunteering, we really want to encourage the people who were outreached to, which are geographically and randomly selected to be able to participate. We hope in the future that there may be additional opportunities, but for right now, it's focusing on the ones that we reached out to.
How many responses have you gotten?
We're still assessing that. So we'll hopefully in the future, once we're able to say overall, be able to tell you what our response rate is. But in the meanwhile, want to strongly encourage everyone to participate if we reach out to them. In terms of the homebound approach, we have made and worked with our emergency medical technician colleagues some accommodations that allow for being able to assist with this process. But the vendors that I referenced this bringing on just puts in place a comprehensive program so that we are organized in how we are reaching out to the individuals we have connected with. We certainly will welcome a partnership with EMT to support us in that process, but really just want to have a comprehensive and organized program that we are overseeing to make sure that those that need the vaccine get it effectively.
Governor McKee, last week Rhode Islanders celebrated the one-year anniversary of the 15-day executive order to flatten the curve. Governor McKee, when will your administration publish public health benchmarks that, when met, will result in the suspension of the state emergency order, restore civil liberties, and eliminate the arbitrary shutdowns that have destroyed the private economy?
As soon as we get people vaccinated, that's the key. We need people vaccinated, and once we hit a certain level where we know that we're safe, we will do that. But until then, we're still in a mode where we're in a safety mode at the moment, and we're doing everything we can to open up our schools and our economy in a strategic and safe way.
But follow-up, as you know, as a veteran of the small business economy, you know that benchmarks are critical because that establishes guidelines. Right now, we live on a week-to-week basis, which is encouraging this week, hopefully great next week, but shouldn't there be a set of benchmarks that, when met, will reopen the economy as opposed to this constant moving target that we're almost there, we're kind of there?
Yeah, I think it's a good point, and we've already started discussing to get off the hospitalization and mortality rates and getting into percentage of vaccinations in the state. So I think that's going to be new metrics that'll be there. As I just mentioned, the vaccinations are front and center. I think that Dr. Alexander Scott, the Health Department, has controlled in a very serious way the hospitalizations, and now we can, hopefully we're going to be moving that direction where we're going to be measuring it by percentage of vaccines.
One quick follow-up. The hallmark of the previous administration was to sit on the federal money, and you were openly critical of that in a professional way. But when will we see, as the money now is being determined to the state level, when will the state publish how much money and at what timeline is going to be available to small businesses who were largely, I think, avoided in the last set of federal benchmarks?
Yeah, very quickly, I think that we've announced in the budget that we're going to access $30 million from last year's CARES Act dollars. I'm glad you asked the question, because I would say we're going to be having a very aggressive effort to get PPP loans out to people. That's been extended. That's an important thing. It's been extended from the end of the month to the end of March. And then we're going to continue to work on restriction strategies that could potentially be lifted, and that's going to be an ongoing situation. I don't know, Stephen.
May, sir.
May.
Yes. Yeah.
Please. Yeah, I'm sorry, May. The PPP has been extended from the end of March to end of May. That happened, I think, in the last 24 hours. Those PPP loans, millions and millions of dollars. So every business out there, please give us a call, give Commerce a call, and get some money into the pockets of our local economy.
Governor, last night the President said that he would like to see eligibility extended to all adults by May 1st. That's not our current timeline. Are we going to do that?
So that's the goal, right? And the goal is, and our capacity, you know, as Tom McCarthy has told me coming in here, is 100,000 shots. We're capable of doing 100,000 shots a week right now, and we've ratcheted it up. So the absolute goal is to open it up and to, as I asked Dr. Fauci yesterday, you know, we'll be prepared for the supply. Get us the supply, and we're doing the work on a local level and a state level to make that happen.
What's our latest guidance on supply? How many doses are we getting next week, and how many do we expect in the weeks ahead?
Yeah, I'll defer that to the Dr. Scott, Alexander Scott, or Tom on that one.
We're currently at about 48,000 doses a week. There are marginal increases in that on the week or two that follows, but that's as far out as we go. We are very much looking forward to, especially with the announcement yesterday, additional updates significantly increasing the supply that we will be receiving.
Just one more on vaccination. We still do have a significant number of cases in the 70-plus range and the 60 to 70 range, and they're not in nursing homes now. So, Doctor, does the contact tracing tell us where those cases are coming from, or is that vaccine hesitancy or folks that we aren't able to get vaccinated, or what explains those cases?
Well, while we are over 70% for vaccinating those 65 plus and 75 plus, there are still individuals that do need to be vaccinated from those communities. And it certainly could be a combination of access as well as willingness, all of which we are positioned to overcome and address so that we have all of the individuals who qualify and who are at highest risk fully immunized and vaccinated.
Stephen and Bill. Thank you. Thank you, Governor. Can you expand a bit about how your conversation with Dr. Fauci came about? What specifically did you talk about?
Yeah, so that came through our office and the, I believe, the National Governors Association. And the conversation, it was great talking to Dr. Fauci. For me, it's like an older brother. It's like a grandfather for others. But he was very, wanted to hear what was happening in Rhode Island. He was aware. He was very pleased to hear that where our infection rate was in that 2% area over the last several weeks. He was also very encouraging about our ability to vaccinate when I laid out our capacity. He was also encouraging, which was good for me to hear, a strong municipal outreach in terms of many factors, including the hesitancy. And he felt as though that was a really strong policy. And when I told him that we were doing that as a former mayor, he was pleased about that. And he also felt as though that our density may have initially worked against us in some of the numbers, but our density right now is going to really work in our favor to get vaccinations out and to reopen our economy. So it was a very positive conversation, and we're going to get back to him and make sure he's in the loop of what's, knowing what's happening here in Rhode Island. He's a national figure that could be very helpful to us.
Great. Bill?
There are some events that are scheduled or potentially scheduled for this fall, and there's one event person that reached out, an event planner, that says that he's reached out to DVR, Commerce, the Department of Health, and hasn't been able to come up with, even get an answer back as to whether or not he can proceed with this event, and he's now turning to his municipality, in this case Charlestown, for guidance on whether or not an outdoor festival in September can take place. Where should event planners of any scope go to? Who's the czar, so to speak, on this matter, so people can plan looking forward?
I'll pass that to Stefan, but follow up on Dr. Fauci. As I was talking about, he felt as though that we were in very good shape this summer on those events, but I'll defer to Stefan to talk about that.
Thank you, Governor. Any large-scale event that is seeking initial guidance and initial input, feel free to reach out to the Department of Business Regulation. They will work in tandem with RIDO, with Dr. Alexander Scott's team, to start to understand the parameters of the event, whether spacing is inherently possible at the event, whether there can be demarcation markings on the ground, whether there are safe ways to conduct the entrances and the exits, where there can be pinch points, so they can have that conversation. You've heard us open up for venues of assembly today to certain levels, for example, 500 people outdoors. That may not be sufficient for some larger scale events that would ordinarily happen in the summer. We will welcome the input that I described, and in a future iteration of this guidance, if public health trends remain favorable, we will start to offer guidance for even larger scale events.
This person is saying they're not getting any calls back, though. Is there a hotline or any place that they can go for a guaranteed response?
No, give us the contact information,
Yes.
Bill, and we'll just go directly there, all right?
The convention center staying closed is really impacting the businesses of downtown Providence. Is there any discussion on how we're going to help tourism in the city, especially this summer? And what does a preliminary recovery plan look like right now?
Yeah, I'll just quickly answer that. I mean, and then to go to Stefan as well. Many conversations. We've had conversations with the Providence Foundation this week about that, the Rhode Island Foundation about that. We know that the Providence has been more impacted than say, some of our tourist areas, which are down 20–25%, but Providence is down as much as 70%. So I'll let Stefan kind of give the details. I'm very aware of it, and we intend to act on it, in particular any area like Providence that's down so far because convention centers are closed and other activities are closed here in Providence.
Very much so. I'll note that one of the reasons that the governor and we are so enthusiastic about helping restaurants get reopened in fuller form is that we know that ours is a major food scene on the global map, so we want to enable our restaurants to become vibrant places again. We're very grateful to the Rhode Island Hospitality Association, the Ocean State Coalition, and the Small Business Coalition for their advocacy and their partnership on these points. So we're starting with some of the categories that will be tourism assets. In addition, Matt Schief and our team at Commerce are already in discussions with all of the regional tourism bureaus about their plans, and we are heavily in discussion about how to use federal dollars to leverage some pre-existing dollars and really accelerate a marketing campaign about the way in which we'll have both an exciting scene and a safe scene here, hopefully as soon as this summer. So stay tuned for more, but we are actively working on a tourism strategy.
I would also add the office space in all our communities, including Providence. We're starting to talk to people who manage and own those office buildings, because we have to get them back, and Stefan announced a 50% occupancy in our office buildings. That's really critical for the downtown area in terms of, going to lunch, having a haircut, going around the corner to get certain things done. So we realize that, and we need to make sure that happens. The other thing I would just say on the flexibility, incremental flexibility, is that we also got to build consumer confidence here, right? So I think that as you move it along, and then Dr. Alexander Scott can keep on reporting that we're following these guidelines and following these protocols, we're going to build more and more consumer confidence, and that's as important, quite frankly, as opening up, right, to get that consumer confidence. So, yeah, we're focused on that. When we get the vaccines, we'll go into office buildings. When we get the vaccines, we will be ready to get people back into the areas that they need to be in. But right now, we're focused on these municipal, regional health department sites and the state sites as well.
To that question as well, is there any flexibility to reopen the convention center? I know that it's still warm from the hospital, but it will take the team a couple months to disassemble that and actually turn it back into the space that it's intended for.
Yeah, we're expecting that's going to happen sometime, but again, we're going to make sure that it's the safety issues first, and it's another opportunity for me to repeat about the variants that are out there, to be very, very disciplined on that issue. And the more we are, the more we open up, and we're looking forward to the time frame when we don't need that field hospital.
And Amanda.
Governor, good morning.
Good morning.
Back to small businesses. When there was a rollout of money last year through Rhode Island Restore, there were a lot of criticisms about how difficult it was to apply. Sole proprietors were out, that the state was making decisions about whether a company was going to survive or not. Now, I've heard from some small businesses who haven't, but they still have debts. And I had one guy who contacted me who said, look, I've tried to negotiate with the bank. They're not negotiating with me. All these other businesses got money. What are you doing for me? So is there money of all these billions that are now coming to the state? You've got a guy, it may not be small money in terms of hundreds of thousands of dollars, but it's big money to him because he can't get on with his life. He needs to settle debt, move on, and he's looking to the state because the state shut him down. What's available to him?
Well, what's available immediately is the PPP loans if they qualify, right? That's really important. This is tens of millions of dollars. We'll definitely have a smaller type of a grant that will help thousands of businesses within the next, what do you figure, Stephen, 30 days or less?
Yes. This is for a business. He's shut. He's got debts he needs to pay off. Payroll, he has to show that he's putting that back into the business. The business is
again, have him call me. You got my number. Have them call me. You got to zero down into the particulars before you could answer that question.
He's not the only one. There are other businesses out there. And so under federal guidelines, I mean, is it as simple as saying you can't give money to a business that's dead, or is there something that's available?
Are you talking about the new stimulus dollars?
I'm talking about any dollars.
Well, right now, we're still trying to get the criteria, of what you could use it for. But if we can be aggressively helping the businesses, we're going to do it.
Question from Amanda in the back.
I have two questions for the doctor. You said that we're getting about 48,000 doses a week. Is there a number that we would have to hit weekly to guarantee that we hit that May 1st date?
Is there a number that we have to hit weekly to guarantee?
Increased dose, we're getting 48,000. Does that guarantee us to hit that target goal of May 1st? Or are you hoping to get more doses, and what number is that to guarantee us to hit that?
Oh, well, as described, we have the capacity to go up to 100,000 a week. We currently have the supply for 48,000, and we can even go beyond that capacity. So as soon as we are told that there is the additional vaccine supply that would be needed in order for everyone to be vaccinated by May 1st, we are ready to get started. Do you want to add anything?
Yeah, thanks, Doctor. So, with that, the bottom line here in Rhode Island is we want to make sure that we are prepared to be successful, affecting what we can control, which is building that capacity to administer as many doses come into the state. And as we look at the guidance that the President put out yesterday, opening it up to all Americans by May 1st, we're looking to make sure that we are set up for success in that regard. Streamlining the scheduling process, other ways that we can better meet Rhode Islanders where they are so that we can quickly get shots into arms.
Underlying medical conditions, it says that as we get more doses, more conditions will be added. When will that happen, and what medical conditions can people expect to see on the list?
The Centers for Disease Control and Prevention has a list that has additional conditions on it. We also know that our very important behavioral health conditions were actually not included on the CDC list. So as additional vaccine supply is available, we will want to expand to those conditions as quickly as we can. And we'll continue to inform people. We started with this particular list based on our own Rhode Island data. The diseases that are, or the conditions that are included are ones that by and large had a multiple-fold increase in being correlated with being hospitalized here in Rhode Island. So we wanted to really target those and then be able to expand to the other list, the other conditions on the CDC list, as well as other very top priority conditions that we know, such as our behavioral health conditions. And we'll be moving to that as soon as we can, and hopefully with the announcement it'll be even sooner.
Last question.
Thank you. Governor McKee, as we've heard time and time again, the spread of COVID is not in K-12 schools, yet you've decided not to include university professors and college professors in this latest push. We're hearing from a lot who are upset about this. The spread is at universities and colleges from what we're seeing. How do you square the two? What do you say to those professors who are upset that they can't get the vaccine like the teachers and school staff in K-12?
So the goal is clearly to have all our K through 12 open fully in September, and the universities. So I've had conversations with the presidents this week, and I have asked them for the same count that we've asked our local school districts to give us. How many doses do they need in terms of getting the the professors and the staff there, because that definitely will get on the list, because that's our objective. So we've already started those conversations. And also, interestingly enough, there seems to be some support for making sure that, just like on the chicken pox or something like that, that students that come in, there's consideration right now to actually have them vaccinated as well before they start school.
Thank you,
Do
everyone.
you have a time frame when you think that university and college professors will be added, the next eligibility group? Just when can they expect to actually be able to get their shot?
Well, we got to take a look at the information and see how many, what the numbers are in all our universities, right, state and public, or private. So we'll be able to report back once they give us that information. I requested that this week.